Berberine is an active compound in a variety of plants and is used in traditional medicine. People claim that it's beneficial for diabetes, high cholesterol, and parasitic infections. Berberine has been studied for heart failure, diarrhea, infections, and other health conditions. Berberine itself has many purported beneficial effects. It's often used for diabetes or cholesterol issues, and some evidence supports this use. A topical application of berberine gel at 5 mg per gram reduced pain and ulcer size in 84 people with canker sores. According to one meta-analysis, berberine may be beneficial in people with type 2 diabetes. In one study, berberine at 500 mg 3 times a day for 3 months, it performed similarly to metformin, a diabetes medication also known as glucophage. It reduced the hemoglobin A1C level, fasting blood glucose following a meal, and triglyceride level in 36 patients with the type 2 diabetes. In the other half of the study, 48 patients with type 2 diabetes treated with berberine had similar results and also reduced plasma insulin. Total cholesterol and LDL decreased also. In another study, 1 gram per day of berberine reduced fasting and post-meal blood glucose and the HbA1c, triglyceride, total cholesterol, and LDL levels. In rat studies, berberine increased insulin expression, beta cell regeneration, antioxidant activity, and it decreased lipid peroxidation. Based on the existing clinical evidence, berberine may help to control blood sugar in people with type 2 diabetes when used as an add-on to conventional therapy. Scientists have raised numerous hypotheses about the ways that berberine can help with diabetes on a cellular level, including directly increasing AMPK, which stimulates glucose uptake in the muscles and helps to balance high blood sugar, delaying the breakdown of carbohydrates into simple sugars, enhancing glucagon secretion, mimicking insulin's action by increasing the ability of the body to take up glucose, decreasing glucose transport through the intestinal lining, and increasing adipocytin, a protein that helps to regulate blood sugar levels. By activating the blood sugar transport activity of glucose transporter 1, by activating the fatty acid receptor GPR40, by protecting the beta cells of the pancreas against cell death, by inhibiting the production of glucose in the liver, by improving the gut microbiota, by inhibiting NF-kappa B, and by increasing insulin receptor expression. Both berberine and a multi-ingredient berberine supplement given daily for 4 weeks reduced total cholesterol, LDL, and triglycerides, and it increased HDL. In another study with 32 patients with high cholesterol, berberine supplementation for 3 months greatly reduced cholesterol, triglycerides, and LDL cholesterol. A supplement containing berberine, 500 mg, with other herbs lowered total cholesterol, LDL, and insulin resistance, but it didn't affect the HDL level. This was in a trial with 80 patients with cholesterol issues. Based on lab experiments, scientists believe that berberine may lower the LDL by increasing the activity at the LDL receptor in the liver, by reducing hepatocyte nuclear factor 1 alpha, by inhibiting lipid synthesis through the activation of AMPK. According to a large meta-analysis of clinical research, berberine supplements in combination with conventional therapy reduce systolic blood pressure after 2 months. The combination lowered systolic blood pressure, the upper reading, by 5 millimeters of mercury, and the diastolic blood pressure, the lower reading, by 2 millimeters of mercury, when compared to treatment with drug alone. Berberine at 1.2 to 2 grams per day, combined with several conventional therapies, increased the quality of life, the exercise capacity, and reduced fatigue, and it decreased death rate in 156 patients with chronic congestive heart failure. Berberine showed the potential to improve aspects of cardiovascular health in rat studies. It was also researched for the possible protective effects on the heart muscle that were injured by the return of blood flow after a blood flow restriction, such as after a stroke. When added to standard drug therapy, berberine may help to lower high blood pressure. Some evidence suggests that berberine may improve metabolic health in women with polycystic ovary syndrome and insulin resistance. In clinical trials, berberine taken for 3 months prior to ovarian stimulation for in vitro fertilization, it reduced fasting blood sugar, insulin resistance, total cholesterol, LDL cholesterol, triglycerides, testosterone levels, and waist-to-hip ratio. Berberine also increased HDL cholesterol and sex hormone binding globulin in women with polycystic ovary syndrome and insulin resistance when compared with a placebo. Supplementation also appeared to improve the lipid status, like the LDL and the total cholesterol, compared with metformin, the standard drug of choice. In one study, it was as effective as metformin, but with fewer side effects. In another study, it didn't improve the outcome when added to a new drug that stimulates ovulation. Further research would be needed to clarify these mixed results. According to some clinical trials, the berberine may improve the metabolic health in women with polycystic ovary syndrome. Its impact on pregnancy rate is less certain. Berberine is a popular weight loss supplement, but evidence is lacking to support its weight-reducing effect. In one study, berberine at 500 mg 3 times a day for 3 months, it resulted in an average weight loss of 5 pounds, as well as an improvement of triglycerides and cholesterol status in the obese patients. Berberine at 300 mg a day for 3 months reduced the BMI and leptin levels, a hormone involved in hunger, in patients with metabolic syndrome. Berberine inhibited the production of body fat cells through the upregulation of CEBP inhibitors, CHOP and DEC2, in a cell study. Berberine combined with malaria medication was more effective against getting rid of the infection than other combinations of drugs. The antiparasitic effect of berberine is being researched in anaerobic protozoa. Berberine-containing plants are traditionally used as anti-diarrhea agents in Chinese and Indian medicine. Berberine was able to inhibit secretion of toxins produced by intestinal bacteria in animal models. Some scientists believe that the berberine can reduce a leaky gut or intestinal epithelial tight junction damage based on research on a mouse model. It's also preferentially increased short-chain fatty acid producing bacteria in rats' guts. Its normalizing effect on the gut bacteria was able to improve the symptoms of fatty liver disease in mice in another study. Berberine also reduces the damaging effects of TNF-alpha inflammation on the intestinal lining. Berberine may have anti-inflammatory activity. It reduced inflammation on the airways caused by inhalation of cigarette smoke and from dust mite allergens in 2 mouse studies. Inflammation of the blood vessels was improved by berberine. It also reduced inflammation of the liver of the fat tissue in an animal model on non-alcoholic fatty liver disease. Berberine helps with osteoarthritis and rheumatoid arthritis in animal models. Berberine improved learning and memory caused by diabetes in rat studies. Researchers hypothesize that the berberine may improve memory by stimulating cholinergic enzyme activity and reducing inflammation, preventing the cell death of neurons with reduced blood flow. Berberine protected against toxin-induced liver damage in rats via antioxidant effects. It also protected against infection-related liver damage in mice. In rats with ulcerative colitis, berberine reduced inflammation, but it also killed the commensal good bacteria in the gut. In another study, berberine reduced inflammation in the gut of mice with colitis and intestinal damage. Scientists believe that it might inhibit lipid peroxidation, intestinal bacterial growth, and NF-kappa B inflammation. Berberine can help to relieve injury to the kidneys in diabetic rats with kidney issues. Scientists are exploring whether the berberine works by inhibiting the NF-kappa B or by inhibiting aldose reductase and oxidative stress in the kidney cells. Berberine increased levels of key neurotransmitters in the hippocampus and the frontal cortex of the brain. Neurotransmitter balance contributes to a good mood. A rat study investigated the effects of berberine on depression and anxiety that often follows morphine addiction. Berberine reduced brain cell death in rats that were given strokes via reduced blood flow to the brain. In a cell study, berberine increased the level of enzymes that are associated with the regulation of inflammation of brain cells. Berberine inhibits proteins, beta-amyloid and amyloid beta peptide, that are involved in Alzheimer's disease in cell studies. Berberine creates new mitochondria by increasing the SIRT1 and the NAD to NADH ratio in rats. You could check out my video on mitochondrial boosting supplements for more information about this. Scientists are investigating whether berberine has any effect on cancer cells. Berberine is being researched on many different cancer types, such as brain cancer, breast cancer, cervical, colon, liver, lymphoma, oral cancer, and thyroid cancer. Repeated doses of berberine inhibit the cytochrome P450 in humans, altering the normal breakdown of other drugs. Mild adverse digestive issues were observed among a few subjects in studies, such as abdominal discomfort, nausea, distension, and diarrhea. Typical doses are 500 mg taken 3 times per day. You can check out my anti-aging video for information on using berberine, DHEA, and growth hormone to reverse epigenetic aging. For more information about herbs, supplements, and health conditions, check out my website.